Okay, hi, this is Holly from Critical Care on Your Side, and just a really quick, more on a lighter video, lighter side of the ICU is what is so alarming with all those alarms? Why are they always going off? Why is there always another sound? And it's kind of, I smile, and it's not that it's funny, it's just that it is a problem, and there's some terms for it. Um, because it adds to the background sound that we're so used to, that there's a numbing to it. And with that said, we're in the environment to where those alarms mean things to us. We know exactly, if you're in the ICU setting, as I am in my institution, I've been there for 12 years, and I'm listening to these beeps and sounds. I know exactly what that machine is, and I know exactly what it's saying to me, and I know exactly, a lot of things. Sometimes it can get ignored, and that can be an issue. But there are also different levels of alarms, like the more critical machines that monitor your heart rate and blood pressure and what have you, more critical machines. They also have like little reminder sounds like, hey, this is kind of disconnected, or it's not the best connection, or I just lost connection. And it's kind of smart enough to sometimes know that it's not the person, that it may just be the connection. Sometimes it doesn't. And the sounds and alarms get more and more annoying. So as things get more and more critical, the sounds get more and more alarming. And so you get certain sounds that happen, and you'll see everyone kind of perk up and like, what's that? Who's that? Who's that? I'm, yeah, everyone's kind of on that. But with that said, we're also not really too reactionary. We're like, sometimes it catches us, but a lot of times we see things coming. And if you have a patient that's really critical, um, people are aware that are around you that are going to be your assistants and your help. Charge nurses know, and you're preparing for those alarms. You know those alarms are going to be off, and we don't silence them. We can't silence them. We can't just turn them off. And so, when you are at the bedside with your patient, and there's usually a bedside monitor, and you can see all the things that are going on, and you're sitting up there and you're entranced by the wiggly squiggly lines and the numbers, and you're trying to figure out what it all means. Relax. Look at your nurse. If they are cool, calm, collected, not running in a panic, then chances are everything's okay. If they are kind of panicked, I'm going to say this jokingly, but maybe they're a new grad. But sometimes, there's real panic. Sometimes there's some really big issues going on, and the numbers aren't right, and the alarms are telling us very useful things. And you're going to have a nurse that looks like she's busy or he's busy, and they will tell you, something right now, I can't stop and answer these questions. And you are going to be an observer. And this is why you're here on this channel, is because you've observed some of these things and you're wondering, what the heck? I'm at my patient's bedside and I see these things going on the monitor, and I hear this alarm go off, and it looks like it's coming from my patient's monitor, but why aren't they answering it? Why isn't anyone jumping up? Well, I can also see it at the nurse's station, and I can also silence it from the nurse's station usually. And I'm not coming and running in because it's not like that. Again, these videos are done to give you guys some time in a venue that I can afford to take it. At the bedside, I can't necessarily afford to take it, and it may not be something critical that's taking my time. It may be something as simple as I do need to sit down and see if there's new orders, or what are those lab results, or call a physician, or chart. I mean, I have things that I got to do, and so for the sake of time, which is very finite, I have to be very selective of what I keep on hopping up for. And when it's something, because your patient's eating some Jello and their little glowy thing on their finger has lost connection, and all of a sudden you get a beep, I'm not going to get up and get that. I know exactly what's going on. They're eating Jello, and So anyway, I I hope that that didn't. I hope that answers some questions. I hope that it doesn't cause too many concerns. And I just want you to know that we don't take it lightly. Um, that we in the field, believe it or not, as a new grad, I remember going home after the first couple of weeks, and you have this incessant alarming, whether it be a ventilator, a machine for breathing, or whether it be the monitor, heart rate, or something that's going on, and you literally go home and close your eyes and you can hear it. You can't turn it off. It's terrible. It's the most terrible thing. And so we are aware that it adds to the environmental stress. It keeps patients from sleeping. It stresses you guys out, which in turn stresses us out even more. And so we do want to try to control the milieu of the unit, and by doing that, we do try to control those alarms. If you're really truly concerned about them, though, if there's something that you're seeing that you really want explanation for, something, that's what we are for. That is my job, and I do love to take the time to explain everything as I'm going about doing it. It is harder when I'm busy, but it's something that it definitely benefits everyone if everybody seems to have a little bit of understanding. But I think it's a real valuing of the family, of the patient, and of the nurse when you can understand that everybody has a role, and that it's my job to really appreciate your role in being vigilant for your patient, or the patient being aware of their settings and what's going on with them, and the nurse being aware that this is our role, is to educate. It's a huge tenet in my license, is to be an educator, and that's not just about these little things, but some of the bigger stuff too. So, with that said, you're gonna have alarms in the ICU, and that's okay. All right, take care.